Hey, you all, welcome back. I need you to hit that like button and that subscribe button. And here we go. It's time to wake up. My friends, today I want to introduce you to Dr. Herbert Smitherman of Wayne State University. And he's just an amazing researcher. And this little guy, this little diminutive doctor, has scared this big old 57-year-old to death with his latest set of research on aging in Detroit. And I never thought I would consider myself a part of the aged population, but I fall right into one of the groups he examined. Dr. Smitherman, so I don't mess it up, tell everybody what you found.
Well, let me start by saying, in order for a community to make sure it's healthy, you have to sort of pick up the signs. So I'm going to go back a little bit in history and simply say that Paul Bridgewater, who was CEO of DAAA, Detroit Area Agency on Aging, came to me and said, hey, I'm responsible for the seniors in Detroit, making sure they get services, food, making sure they get support needs, health needs, etc. But we are seeing a loss of our seniors. It's just like what happened in Flint. A doctor saw exorbitantly high lead levels in kids and basically said, why is this happening? What the DAAA saw was, we're losing seniors and we don't know why. When we go up and talk to Lansing, et cetera, they're saying, well, it's all out migration. The theory was, or at least the prevailing theory at the time, was that the decline in the older adult population in Detroit was out migration. Seniors were leaving Detroit for the suburbs.
Let me get this straight. So Detroit Area Agency on Aging
Yes.
noticed that they were losing an amount of seniors.
Correct.
They take it to the state. The state says, well, they're just moving to warmer environments or some other environment outside of Detroit.
So yes, they were taking this to different, both nonprofit and public agencies like the state, and basically saying we're losing seniors. And this was important policy-wise because the politics and the politics of this was, the issue was on the table about the use of tax dollars associated with social services for seniors in the city of Detroit. It was at stake. There were conversations at the state level and at local levels in regards to changing the way they distribute the dollars from a needs-based formula to a population-based formula. So if your city's losing population, that means money is going to go out of the city. I'm sorry, if your city's losing population, money will go out of the city to other cities. If it's need-based, it's going to be based on the intents of the health status of the population. So as population leaves, money leaves. So they were talking about restructuring the dollars for seniors in Detroit because the population was declining. But everyone said, well, they're just leaving. Well, what DAAA at the time did is they commissioned us. I'm at Wayne State University. I'm a researcher in the School of Medicine, to say, can you tell us why this is happening? And what we found is that that Detroit did lose about 23% of its older adult population, and that's defined as age 60 and above, between the years of 1990 and 2000. As we studied this, we continue to see that kind of loss. And the question was why? Really why? And what we found was that most of this loss, the bottom line was the cause of most of this loss, was because over 33% of the older population lost in Detroit was because they were prematurely dying. It wasn't because they were leaving, it's because they were dying. And if you look at people aged 50 to 59, they had 122% higher death rate in persons in Detroit, age 50 to 59, in comparison to people aged 50 to 59 in the rest of the state of Michigan.
Doctor, hold on a second.
Okay.
Let's go back to the whole 33%. You're telling me 33% of the people, the seniors that were no longer counted in Detroit, were not moved out, but they were prematurely dying. That is true.
Yeah. Yes. So that the cause of 33% of the loss of our seniors was because of premature death. Yes, seniors were dying before their time. And we have found this a trend line. The simple way to put it is that older adults in Detroit are dying at 2 to 2.5 times higher death rates in comparison to everywhere else in the state of Michigan.
Now,
And that's why we were losing seniors. It's not because they were leaving Detroit. It's because they were dying prematurely. That's the issue. And if you look at people age 60 to 74, they're dying at a 48% higher death rate than the rest of the state. And then what happened is the new leader came on, Ron Taylor, and he has continued to promote this monitoring and this analysis. And so we now have 19 years of analysis where we have looked and monitored the seniors in Detroit, and seniors are defined as 60 and above, although we are looking at death rates at age 50 to 59 because what we're seeing is kind of Darwinistic. People are not making it to age 60. People are dying before age 60. The cohort isn't even getting to age 60. Once you get to age 60, 48% of them die at higher death rates than every other senior in the state of Michigan. So we have a lot of premature deaths. And if you pour COVID on top of that, this is all before COVID. This doesn't have anything to do with COVID. This is before COVID. Now you dump COVID on top of that, I always say you have a crisis on top of a crisis on top of a crisis. So you have baseline sort of injustice and racism poured upon. On top of that, you have chronic disease. And on top of that, you now have corona. And it's actually, we're just seeing extraordinarily high death rates. And that's why we saw, African Americans make up 14% of the state of Michigan, but we're 30% of the COVID cases and 40% of the COVID deaths. That's because the baseline before we even got to COVID was a very fragile and vulnerable population that was already dying prematurely relative to all other populations in the state.
this hit home because earlier this week, I took my boat to dry dock, and my best friend and I, who also has a boat, we always go to Sinbad's afterwards. Time's gone past, there were 4 of us. Now there are only 2. I'm 57, he's 58. And he said, Steve, we're going to be around for a long time. When I read your research, and you said in your research that he and I, well, actually, he lives in the suburbs. So I had 122%, people like me were 122% more likely to die than my good friend who lived in the suburbs was. And
Yes.
That's what scared the hell out of me when I read your research.
Yes.
And this is all pre-COVID. So what are the reasons behind this? Are they the same reasons that we hear for the inordinately large number of African Americans dying of COVID?
Well, what I say is that this is about historic public policy. This is policy-driven health, social, economic disparities, and injustice. And for example, cuts in community health centers, cuts in college aid. What I'm talking about is social determinants of health. Social determinants of health. That is, our food, our housing, our shelter, our employment, our job. When you have huge disparities in the social infrastructure of a community, it leads to very poor overall health status. So when you have everything from cuts in public education, cuts in housing, cuts in jobs, cuts in Medicaid, cuts in mental health services, cuts in food stamps, cuts in lunch programs for inner city kids, cuts in after school programs for inner city kids, cuts in healthcare services directly to inner city populations, and cuts to health centers. These kinds of public policy choices that are driven by historic public policy choices, create health and economic situations in communities that make them very vulnerable. And these kind of choices have been everything from our enslavement, Jim Crow, segregation, housing policies, unemployment policies, education policies, healthcare policies. It matters. I'm going to say, I didn't mean to get political, but it matters who's in the White House. It matters who are your elected officials, because they're setting public policy decisions that drive whether a community is going to be supported or not. And if it is not, it makes it fragile and vulnerable. And it leads to the kinds of poor health status that we're currently seeing.
Doctor, here's the problem. No matter who's in the White House, all this economic stimulus that went on during COVID-19 has to be paid for. So I think you're looking at even more cuts, no matter who's in the White House. And that is sad.
Right. But if you have a community that in a 50-yard dash started at the negative 50-yard line and someone else is at the 50-yard line, and you shoot the gun and say, let's go. And then you say, I'm going to start cutting resources to the community that's the 50 yards behind as you're trying to run this race. All that's going to happen is you're going to see these kinds of health disparities and health inequities get larger. And that doesn't overall help America. It doesn't help the country to have large parts of your society that are under-resourced and driven into poverty. That creates all kinds of other dynamics, including higher crime, higher other issues. We pay for it in some way, because if you don't have health insurance, you end up in an emergency room, and you're going to get the care because we mandate you get the care in the emergency room. It's just going to be very expensive. It's going to hit on the healthcare system. They aren't going to be compensated for it. So, this is just a cyclical cascade of challenges. If we don't go upstream and start addressing these challenges early on in the lifespan. So getting more preventive services up front, support services for your population leads to less cost in the long run, and therefore better health, better policy, and better overall lifestyles for your population, and it's less costly. So there's a lot of research that proves if you go upstream and do preventive services, you go into communities and make sure people are stable, you actually have less cost for the future.
All right. Dr. Smitherman, I want to thank you very much. Is there anything else you want to add? Any charge to us right now?
Well, I always say that the most important item, because I am very, very thankful that Detroit Area Agency on Aging conducted this study, and that Wayne State University School of Medicine allowed me to do this. But we have to be vigilant. They have been advocating this over the last 19 years. We will continue to do that. But I will say the most important thing people can do right now is vote. It's called VOTE, because voting in is going to allow the change that hopefully we can influence the change in public policy. You're right. In the current administration, it's going to be very difficult for us to influence the kind of public policy required to change these statistics. Because right now, if we continue to do the same thing, 10 years from now, when we redo this study, we will have the same or worse results.
Okay. Thank you very much, Dr. Herbert Smitherman. I am, man. I'm in the gym every morning.
Wear a mask, social distance. All right.
I try to social. I try to. Thank you very much, sir.
No problem. Thank you.